Hello, good people from the internet, urban innovators, digital health innovators, startups, corporates, institute stakeholders. It's very nice to have you here. I'm excited to host this event with you together for 2 hours. We have a great program jam-packed with great speeches and even networking. So I'm very excited to have you here. Welcome. We're going to spend the time today talking about multiple topics, especially the intersection of 3 different topics that each in itself would deserve a meetup. Smart city on the one hand, or urban innovation, how others call it, digital health or healthcare innovation as a second topic, and of course, the overarching topic, the pandemic and the pandemic's influence on those 2 industries, or specifically the intersection of those industries. So it's going to be an interesting 2 hours. I'm happy to have you here. My name is Darius Moeini. I'm the founder of BIA. I've been doing this for a few years. What do we do? I'm just going to make this very, very short. We are a boutique agency, an academy here in Berlin, independent one. If you know where we are, if you look behind me, and you may recognize the Torstraße, we are right smack in the middle of Berlin Mitte. As an agency, we love this area here. So if you are post-pandemic times, if you're here, of course, you're welcome to visit us. What do? We do innovation programs and training programs for large organizations, for corporates, and lately also for scale-ups that also need leadership training and change initiatives or design in their organization. But you probably know us more from our ecosystem activities, from our innovation hub activities. You may have heard or engaged even with the Smart City Hub or the Future City Startup Incubator. I'll talk more about what this actually is and how you can engage later during the presentation. Or you may have heard that something is in the making around healthcare, a digital health hub or a future health startup incubator. We'll get to it during the course of this event. The agenda for today has 4 pieces. So first, I'm going to talk a little bit about the intersection of smart city and healthcare and why we think it really makes sense. And I will then tell you about all of the different programs we have in our innovation hub, so you can understand whether you're a corporate or a startup or an institute, how you can engage with us and what's your call to action or call for collaboration towards you. Right? We then have 2 great impulses by leading startups, one from Hamburg, one from Berlin. Healthcare and smart city. And we have a panel jam-packed with great people. I'll show you the speakers in a second. And then at the end of the evening, at the end of the session, we have a networking session. We will, for anybody who's still interested to join, we will be at in 1.5 hours, a bit later maybe, we'll come to that stage where we'll ask people, whoever wants to join us on Zoom for a randomized networking session, which is actually quite fun if you do it on Zoom. It's very easy and low maintenance actually, yeah? So we'll be happy to have you there as well. The speakers for today, I'm going to make this very, very short because I'm going to introduce them just before they speak. But we have Robert Heinecke from Breeze Technologies. We have Dr. Langemak, Dr. Shari Langemak from Relearnlabs, CEO there. Professor Dr. Thomas Schildhauer from the Duca Institute. Laura Wamprecht from Flying Health, the consulting and ecosystem firm. Patrick Hennig from Nexenio, the makers of the Luca app. We have Ulrike Breta from Berlin Partner Cluster Health Management, and we have Dr. Jean-Robert Huff, physician lead at Ambos, the medical education company. We will have 2 impulses by Robert about Breeze Technologies and Shari about Relearnlabs and Telemedicine. And later, everybody else will be on the panel. Good. All right. Let me get started with smart city and healthcare and why we think it's a match made in heaven, why we're so excited about it. We've always been a little bit excited about dabbling our feet in the healthcare, but how now really is the hottest time to actually make it happen, to really connect those two industries. Yeah? A lot of people not confuse, but discuss what is a smart city, what is part of the smart city, what is not part of the smart city. Honestly, it doesn't really matter to us. At BIA, at our innovation hub, we don't care. We don't care about making long rounds of discussions about what is the definition of a smart city or not. To simplify, I can tell you that we think about it in 4 different areas. We have the infrastructure part, hardware and software. That can be anything from streets, but also street furniture. Yes, it's called that. It's literally called street furniture. 5G, data platforms, software platforms, everything that's really hardcore infrastructure that we put in this bucket, right? Then we have digital government, or e-governance, as you may call it, whether that is the digitalization of the internal governmental process, literally digital transformation of the state, and as well the citizen-centric touch points, the citizen services, anything visible for you and me when we interact with the city or the government. That's digital government. Then we have city services and operations, right? Whether that's traffic systems, it's the police or fire departments, schools, but also more importantly, oftentimes in smart city conversations, are the utilities, energy, water, waste, which are a very, very strong stakeholder and operator, bringing life to the city, literally bringing life to the city. The 4th bucket is quite interesting. It's urban innovation. It's the least defined. It's pretty much a collection of everything. Any touch point, anything that has a touch point with a citizen in their experience of living in a city or even in a suburban area, whether that's mobility or buildings or energy, retail, circular economy, security topics, right? Why am I saying this? It's because the 3rd and 4th bucket are quite interesting for me, especially because there is a lot of potential for cross-sectoral collaboration, right? Because it's less of B2G environment. It's oftentimes quite company-to-company environment. Oftentimes it is possible to innovate and experiment by trying out new products and business models and processes that cover multiple sectors and multiple industries, from what I just said. And I'm going to show you a couple of examples just for you to get a sense of what I'm talking about when I say smart city innovation or urban innovation, and how it will then feed into the topic of healthcare and how we can make sense of it. Couple of examples. If we have a mobile phone provider, a network provider who can not only track the patterns of movement of people and cars, but also assess it and deliver this data in real time, we have multiple of use cases that are already implemented in different cities throughout Europe. For example, with this real-time data, we can redirect traffic instantly in real time. I mean, of course, we can redirect based on pattern assessments, but in real time, it's a whole different ballpark. And therefore, it's a fantastic case where cross-sector collaboration really works and creates value for the citizen. Real-time traffic redirection. Or even, in some cases, even less exciting, but actually quite useful, light dimming. In some cities in Europe, the lights are dimmed when in real time it is assessed that not a lot of people are in the street. Very small case, but actually in large metropolitan areas saves the city, in some cases, multiple million euros per year by saving on energy. Very typical, maybe not very exciting, but very typical smart city case for you to get a little bit of an understanding of what we're talking about. Let's look at a couple of other examples. For example, access management for buildings. If we create more innovation in the building sector and implement more of access management, digital keys pretty much, yeah? So many new processes can be optimized. For example, last mile delivery, your Gorillas or Amazon delivery can come through with digital opening doors and closing doors again. Same with waste collection. The processes for waste collection companies can be quite improved if we have a better building management and access management system in place. Again, not very exciting use case, but a very, very useful use case that has not been deployed to a lot of cities yet, but will be hopefully in the future. Just look at the car, the electric car, and how it is changing so many different industries or influencing so many different industries, right? We used to have cars, engine, we would fuel up in a gas station. Now we want electric vehicles. Electric vehicles have a different paradigm in charging their car, not fueling their car, they're charging their car. So what happens? Gas stations are drastically being disrupted, and the charging is democratized and it is decentralized, which will have a major effect on buildings. Every building now has to think about the fact of how do we empower electric vehicles to be charged. So mobility meets buildings, meets energy, meets retail. For shopping centers have to rethink their parking strategies and building setup. Right? The entire parking industry has a new opportunity for a business model for charging vehicles. So many different industries are all drastically influenced by one product innovation, which is the electric vehicle. This is what I think is a fantastic use case of a smart city. Multiple industries really, at the end of the day, working on innovations and business models to improve the citizen experience and the business operations within a city or suburban area. Okay, now we have a little bit of an understanding as how we interpret smart city and what kind of possibilities there are. And now let's talk about healthcare. Of course, the case is related to COVID-19, the pandemic. Just look at all of the different things that had to be implemented or should have been implemented in a better way in some cases because of the pandemic and what happened in the last 2 years, right? So the pandemic broke out. So we have to get tested. So the testing, the decentralized testing environment had to be scaled up all over the city. That for itself, a huge project, right? We have to do tracking on where we go. We have one of the very relevant people here for that. The tracking solutions, multiple ones are on the market, had to be innovated, had to be launched. We have to have an entire operation on vaccinations, millions of vaccinations in a short amount of time. It's not only a procurement issue, it's also a logistics issue in the city. It's an urban planning issue. Right? Air quality control, whether it is generally in the air, whether it's in the tram, whether it's in a building, is of course now on every facility manager and security manager and healthcare manager's mind. We have reorganization of hospitals. We have reorganization in the operations of schools. So many different areas that for itself could be relevant as an urban innovation topic have been influenced by the pandemic. And therefore, I personally am very, very excited to look at this topic as a collaborative topic, as a intersection, as a commonality between smart city and healthcare. It is the best moment for us to collaborate across sectors, come together and think, how can we improve the city experience and the business operations experience within a city between those two industries. That pretty much was in 5 to 10 minutes my understanding of why it really makes sense to bring smart city together with healthcare. It's all about the operations behind it, right? Good. Having said that, I would like to introduce to you what we do in our program, so you get an understanding of how we want to engage with these topics and how we want you to engage with us with these topics. So, as I said in the beginning, many of you have been interacting with us through our Smart City Hub programs or Future City Incubator programs. So in our Innovation Hub, we generally have 3 different areas of collaboration or activity. We do pilot projects. We call them startup challenges, but at the end of the day, they're pilot projects between multiple companies where we facilitate within a few months MVPs, experiments, anything in the area of urban innovation, right? I will show you a couple of examples in a minute. We have a fantastic startup accelerator that is funded by the Berlin Senate and the ESF fund from the European Commission, where we support pre-seed urban innovators and entrepreneurs to launch their ideas in the smart city industries. And we have an innovation community really bringing together many of you, and hopefully many more in the future, for ideation, networking, knowledge sharing, and collaboration in general. Right? Let me give you a few examples. So again, you can feel what I'm talking about here, really. A pilot project we did together with a local hero company, Alba. Alba is actually a globally operating waste collection company or recycling company based here in Berlin. We helped Alba innovate on a specific topic. We worked on turning their waste collection trucks into sensor platforms for the smart city, with an initial use case where we brought together Alba with Vialytics, a machine learning based startup analyzing street quality in real time via their software. So we married those two, the waste truck and the software of Vialytics, and we had already a sensor platform that was moving every day through the city of Berlin. That was an amazing experiment for me. I really love this case because it really shows us that collaboration between hardware and software really can make sense when it really makes sense. Yeah. So that was one of our nice cases we did for a local hero company, between corporate and a startup. Very typical case, smart city. Another one we did was for Fujitsu and its internal startup company, Run My Process. What Fujitsu and Run My Process ambition is to develop also a pretty much, I put it in my words, app store for building management systems and building management services. So a gateway for building managers and facility managers to install any kind of service that they need in their world of building management, property management, right? And so we brought two startups, one from Hamburg, one from Berlin, LeafTech, Energy Management, Comito, Access Management, as their first apps in their app store. Really cool project as well, and hopefully moving ahead with speed. Then another example. I'm throwing a bunch of examples at you for us to get into the groove, get into the mode of what actually am I talking about, what is smart city, what is a graspable innovation or graspable use case in this area. In our startup accelerator that is funded again by the European Union and the Berlin Senate, we are supporting one of the teams that we're supporting is called EcoPulse. What is EcoPulse doing? It's really a fantastic team. They're working on a asphalt additive based on plastics waste. So they're turning plastic waste into streets. Glorious. The idea, but also the operations, the hands-on operations behind this innovation is really mind-blowing to me and very inspiring. So we're very happy to be able to support this great sustainable tech team. Another example, very cool from the very first cohort that we had, Kalima, who is developing a mobile security app for companies who have employees that are on outside of the building. Right, so for mobile employees, they have a security app for instant access to security features. Very useful, especially if you think about all of the last mile delivery activities that are happening lately, even increased through the pandemic. As you see, a bunch of really, really cool cases also for the Startup Accelerator. We have many more also in our portfolio. The magic, of course, happens with all of the partners. The community is all based on bringing corporates and startups, universities, institutes, public services, citizens, tech companies together to form really a circle, to form really a crowd, a squad, some people that create a network to collaborate and co-innovate together. This year's partners are absolutely amazing. We're working with Vattenfall, the energy company, BIM, Berlin's own building management company, Airbnb, Fujitsu, DGVO, Berlin partner, of course, as well as a co-facilitator of many things that we do, and empowerment partners for MVP development, Consa Software, and legal and tax support from BAL office. So as you can see, the diversity of companies in an innovation network like this is really, really great. And the things that can be done, bringing these people together and even more is really inspiring and motivating. Hopefully we will find ways to collaborate with you personally as well. We have, for example, the next meetup that we have, it's actually an innovation workshop happening, I think it's next week on Tuesday even, and we're going to do this one in person. even. So scary. So if you're in the energy or real estate industry, and if you want to be part of this design thinking style innovation workshop and networking, let Anastasia or Thomas know. Maybe they have some spots left. It'll be quite an interesting exercise to bring a few people together to co-innovate. Just one of the opportunities that we have to bring people together and co-innovate and co-ideate. But of course, you're very much looking forward, probably many startups are here right now, to hear about the healthcare activities that we're launching. You may have heard already, we are with the new ambition, post-pandemic motivation, and also with the new startup incubator coming up, recreating our year-long network and activities in Smart City for the healthcare industry, which is going to be very, very exciting. So we're replicating the system towards a digital health hub, from Smart City Hub to Digital Health Hub, and the Future City Incubator becomes the Future Health Incubator. If you want to engage with us on the Digital Health Hub, we will share with you a survey in a minute. I will tell you now in a second again, where you can just let us know that you want to engage with us, whether you're corporate or institute or student or any startup, anything you want to be part of this network, you let us know and we will reach out to you in the next few weeks. But let me make one big last shout out to the entrepreneurs who are part here, because I know some of you are here to listen to this. We're very, very, very happy to be able, an honor to be able to facilitate another Berliner Startup Stipendium program funded by the European Commission, the ESF Fund, and the Berlin Senate. In this program, we support pre-seed companies, entrepreneurs, in an 8-month cohort-driven program for entrepreneurial essentials. What happens there is a bunch of different trainings and networking. We give some funding, 2K per person per month for up to 3 persons per team, which makes almost 50K grant for the time, plus perks, benefits, infrastructure, office, and an amazing network. As you saw, there's so many people within our circles that could help you launch your healthcare company. So if you are interested and you're in any one of these areas, healthcare applications, general healthcare digitalization, if you are in or planning to be in med tech with historically long time to markets, we know that, then do apply. Check out our website, futurehealthincubator.com. You can also look at the verticals a bit differently. Anything health at work, health at home, health in the city. It's all interesting to us. Anything that is healthcare and or urban innovation could be relevant for the program. The cohort starts in October. You can still apply this month. The two wonderful Victoria and Florencia can answer you any questions about it. You can find more information on futurehealthincubator.com. Or just contact us and we will tell you all about, answer any open questions. We're really currently looking for entrepreneurs in the healthcare sector. I'm pretty much done for my part, everyone. I had exactly 25 minutes. This is done. If you are interested in engaging with BIA and BIA's Innovation Hub, whether it's Smart City or Digital Health or both, we are sharing with you right now the survey links, those are type form links. It'll take you 5 minutes max to fill that out, probably less. Fill it out, let us know what you have on your mind, who you are, what you want to do, how you want to engage, and we will reach out to you in the next few weeks on how we are designing our network and community activities. Whew. I made it all happen in 25 minutes. I'm very happy about that. My team anticipated that I will take longer, and I'm very happy it didn't. I'm very happy, though, right now that I can introduce to you the next speaker, the very wonderful Shari Langemak, who is the CEO of Relearnlabs. Relearnlabs is the company behind Alve. Alve is the leading teletherapy platform here in Germany. We are very, very excited to hear what she has to say about how she has experienced, or her company has experienced, or her assessment of the healthcare industry and what's possible and what's not possible. Shari is sitting right next to me, so I'm going to make a switch to the right or to the left. and let her come to the stage. Shari, the stage is all yours. We're very excited to have you here.
Hi, everyone. That was smooth. Darius already gave away why I talk about telemedicine today, but I think there are more reasons beyond my company. Just a few things about what I do or what I did in the past. So as he already said, I'm a medical doctor by training. I have been in the healthcare sector, or rather in the intersection of digital and healthcare startups and corporate innovation for almost 10 years. Sounds like a long time, especially as many entrepreneurs will be very young. And telemedicine, of course, has been following me for the past, almost as well, for the past 10 years. So I'm very happy to actually be in that area now. Alve is focusing on teletherapy. That means we're not doing the psychiatric part of things, but we're doing the rehabilitation part, speech therapy, and physiotherapy, occupational therapy. So anything you would do in terms of rehabilitation is can be done throughout our platform. We are focusing on that. So we had a quite an interesting time during the pandemic and beyond, as many other telehealth founders for sure as well. But let me explain to you why I find telehealth so intriguing and why this topic keeps me busy beyond my actual job at Relearnlabs. Namely, because telehealth was one of the biggest hopes of digital health in the past, simply for that reason that it has been around for a while. And already in 2015, I mean, it's not that long ago, but 6 years in the digital world is pretty long ago. Many of the experts expected that video consultations will become standard of care in Germany by 2021. We still have some time left to reach the standard of care, but within the following slides, you might also realize that we still have a lot to do in that terms. And that's what I would like to focus on today with you. Let's look at the expectations we originally have. Let's look where we stand right now, or we stand before the pandemic. Then let's see what the pandemic did to telehealth. And I would like to close my little impulse with some expectations about the German market and telehealth in the future, hopefully at a post-pandemic phase, if we ever reach that. Why is telemedicine such an important part of innovation in healthcare? I think there are probably many, many more reasons, but just to summarize it in a nutshell, telemedicine, of course, saves a lot of time and it increases the convenience, both on terms of the patients and the healthcare providers. It allows access anywhere. This is really important in a future where even doctors will be more professionalized. That is, you don't go to a cancer specialist, but you go to the specialist for breast cancer, for example, because medicine becomes more and more complex, and there distance matters, because not only if you live in remote areas, but even if you live in smaller cities, you might not find the right expert for your disease in the future. The other part is, of course, it improves outcomes by allowing access. Other people who might not be willing to go to the practice every now and then, namely men, they are much more likely to call a doctor and report their issues right away. And of course, that saves costs both on terms of the patients and the healthcare providers and the insurances, because complications will be avoided and patients don't need to pay much for travel time. And the last point is actually something I really like about telehealth. It has low entry barriers, because if you followed and coached a few startups in the past years, you know that most of them struggle with regulations we have within the European Union. We especially have within the German market. And if you think about it, telehealth has maybe theoretically, at least, one of the lowest entry barriers possible. I mean, compared to AI diagnosing your next disease, for example. But still, although we have all these positive factors and we have all these hopes in the past for telehealth, telemedicine, in my opinion, very much falls behind the expectations. And if you look at this, this is a Bitcoin research result we had about video consultations. We see that in 2019, only 5% of the German population ever tried out a video consultation. So this is really small, far beyond from standard of care. And then we, of course, also see the Corona effect in 2020 and 2021, where we have 13, respectively 14% of the population trying out telehealth. You might say, that's maybe not that bad. I say, let's see how many people are actually using online dating or dating apps. And this is almost 1/3 of the population. So the chance is out there that more people use telehealth, but still the adoption rate is considerably low. I like to ask what went wrong. So why is telehealth, especially in Germany, still underrepresented and still not standard of care? And I believe the three hidden guard dogs you have within the healthcare system in Germany are to blame for this. And the first one, probably most of you healthcare innovators already dealt with, is high regulations. We see that in all areas we see in healthcare innovation. But I also want you to not to forget about two other factors which are very important for the adoption of telehealth and beyond, namely a missing added value for healthcare professionals, mainly doctors, and a lack of information on side of the patients. Let's dive a bit deeper into this. I would like to start with the regulation. We all know Germany is quite highly regulated. The European Union is quite highly regulated. But how high compared to other countries is especially obvious in the telehealth case. Only in 2017, we finally allowed telehealth for regular care in Germany. Before, we had something called Fernbehandlungsverbot, so it wasn't even possible outside of model projects to allow teleconsultation. Of course, this had an effect. And even worse, once we allowed telehealth, it was very limited to 6 conditions only. So very, very highly restricted in the beginning compared to Switzerland, a country that that is also very close to my heart because I work with Swiss people a lot in my job. They already introduced telehealth in their country in the 2000s. And we don't need to talk about high tech and super cool video chat. No, they really just introduced the phone within the healthcare system, which is super low tech, but still super effective. So it's no wonder that telehealth is has such a big standing in the Swiss market now compared to Germany. The other one I talked before are the incentives. The incentives for many healthcare innovations are unfortunately still low on side of the healthcare professionals. We mustn't forget that introducing new types of care into the practice costs effort for most healthcare professionals. They need to check if the quality is right, if the security is right. They need to learn how to use this new technology. And if there's not an additional dollar attached to it, they won't do that. And this was especially the case in telemedicine. We have additional revenues that could be created, but they were still quite low. Especially in the beginning, we only saw that if you added up, physicians could earn maybe 800 euros more per year for offering teleconsultation. At the same time, had to pay for software and how to learn to actually use that tool. So that's nothing. But I don't only want to talk about money incentives. Of course, there are more than financial incentives for telehealth. And I think the Swedish example is a really great one. They have partnerships for radiology with Australia. So what they do is, instead of every physician or people going on night shift to evaluate MRTs or other radiology scans, they send it to Australia, somebody will look at it, and more doctors can sleep through the night. And I think that's quite a big incentive right there for your job to use telehealth. The last one, patient education. I don't need to tell you that Germans are really picky about data security and always complain about the missing data security regulations. This is probably one of the reasons why at least half of the patients don't trust healthcare apps at all. And this is really, really bad, I believe, because healthcare apps can have such a big impact in our life in the future. And if you look back at Switzerland, who have been successfully introducing telemedicine within the past or more than 10 years now, you can see that you can create incentives for patients to overcome this resistance or to overcome the resistance to use new healthcare apps. One is, of course, simple information telling them what the benefits of a new solution are, but the other one is also to put financial incentives behind it. And something that Switzerland is doing is that they have a telemed model. So in that case, you pay less for your insurance if you contact a telehealth center before you visit a doctor. So genius principle to engage the rate for telehealth. Now let's go back to the pandemic, something that's very important for today, and that's very important for telehealth as well. And as you might know, the COVID pandemic had a huge impact on telehealth. But why? First of all, something that personally surprised me quite a bit is that regulators were finally fast to make decisions. So something that we saw, especially within our startup, is that the decision makers decided to allow teletherapy, which wasn't reimbursable in the past, within a few weeks and months only. And for the first time, therapists could actually use teletherapy, and they did. More than 80% tried out telehealth within this crucial period of time, which I believe is a huge success case. But also incentive-wise, we had much more incentives for healthcare professionals to use telehealth. One of them simply being that there was no cap for video consultations. Physicians who usually are limited to do only a certain amount of video consultations per quarter could now finally do as many video consultations as they want. And the incentive was even bigger, because while they had to imply or ensure that several hygiene practices were implemented in their practices, in telehealth they could just start right away. And the last one, patient education-wise, I think press did a big thing for telehealth during the pandemic by reporting about how video consultations actually work, that they exist. And I think if you look at the search inquiries, which you can see there, provided by Zavabet, you can see that there was a huge uptake of search inquiries for video consultations during the pandemic or at the start of the pandemic. So now hopefully we reach a stage where at some point the pandemic is over. I think we all hope for that. But what does it actually mean for telemedicine? And to be honest, the answer is not quite clear. There are several factors we need to include. But let's look at the lessons that have been learned throughout the pandemic. First of all, that promising care models need to be introduced fast in our healthcare system and by our regulators. And one example is, again, something that's very important for us, namely that teletherapy will become reimbursable within the German healthcare system. There's a law called Digitale Versorgung und Pflege Modernisierungsgesetz, DVPMG, very German term. And this will allow that this new type of therapy, namely teletherapy, is not only something that has been done during the pandemic, but also beyond. But at the same time, we are still Germans after all. We have lots of regulations that are very slow and very complicated. Namely, we have a certification process for software companies who need to do telehealth. This is just the news about the certification news from the Kassenärztliche Bundesvereinigung, who do a lot of laws about this, and there are ongoing changes on what requirements startups need, and also quite unclear roadmaps on how to implement this. So this highly affects our startup scene, but it also highly affects the trust that doctors and patients have within the system. Another lesson that is learned, and I really like this graphic provided by the Health Innovation Hub. They did a survey of how many doctors used video consultations before the pandemic, during and after. And as you can clearly see here, before the pandemic, the majority of physicians wasn't offering video consultations at all. And the majority was starting to offer video consultations during the pandemic, and even more important and even better, is willing to offer video consultations after the pandemic. So that's a really great result. However, if you look more closely at the data, you can see that only the majority is willing to offer a small amount of video consultation. So still, it's very limited to the niche. It's an exemption and not standard of care, and far away from what we initially planned. Why should we bother? Is it really important that we have video consultation, that we have telemedicine? You might think, of course, you want that, Shari. You work for a telehealth company, so telehealth should be standard of care. But I like to remind you that things will get worse, not only for me, but for the whole society, because our healthcare system, of course, is facing a really tricky time. And many of these things you heard before, we have an aging population with more and more chronic diseases, more requests and demands for ongoing healthcare. We have more and more costs, and therefore we need to save more costs within our healthcare system. And we have more professionalization, something that I mentioned before. So you really need the right expert for your disease, and it's really hard to reach him or her if you live far away. So I think there is enough good reason to allow more telemedicine in our lives, and to find a fruitful ground for telemedicine in Germany. And yeah, thank you for listening to everything I had to say about telemedicine. I'm really looking forward to the panel after. Thank you.
I have never heard anybody use the words regulation and fun in one sentence. Thank you for that, Shari. It was a very enlightening presentation and a fantastic case. Let me go back to my presentation real quick. Share screen, 1 second. I'm with you in a second. There you go. Yes, so a very good case, telemedicine and the ambitions of telemedicine providers to create easy access, also virtually, a great ambition and a great case that is dominant in healthcare, but also now very good for us to understand in the smart city and urban innovation environment. So Shari Langemak, thank you very much for making it here. We appreciate it a lot. As we promised you, dear audience, we have one impulse case from the healthcare environment and one impulse startup case from the smart city environment. We are very happy now to welcome Robert Heinecke, who is the CEO of Breathe Technologies, who will tell us about his product. They're in the business of hardware and software for air quality control and management. We've heard from Robert before and excited to see what's happened since the last time we spoke, which was pre-pandemic times. So So Robert, thank you very much for joining us. We're very excited, and this stage is all yours.
Well, thank you very much for having me. It's a pleasure to be back and to be able to tell you in the next 10 to 15 minutes a bit more about air quality, why it's important, and also what are the considerations in the area of smart cities and health. Let me share my screen, and then we can jump right into the presentation. You should be able to see the presentation now, I think. So, air quality, good health and well-being, and COVID-19 resilience. Why do I think that I'm a good person to tell you about this? Just a small advertisement block in the beginning. In 2015, I founded Breeze Technologies. We are a tech leader in the field of air quality sensors, data, and analytics. So we measure air quality, we analyze air quality data, and we help different organizations to figure out what to do about air pollution challenges. But why do we do that? Well, if you think, where would you rather want to sit? Would you rather want to sit in a super polluted, imagine, New Delhi, India, in the high season of smog, or would you rather be sitting in a forest like this? I think the choice is fairly simple for each and everybody of us, at least those that are not crazy. But I think everybody is going to prefer the fresh, clean, and crisp air that you're going to imagine in a forest environment like this. Air is actually the most important thing for us. And if you imagine, how long can you survive without different things in your life? Well, how long can you survive without food? That's going to be roughly a month. How long can you survive without water? That's going to be roughly 3 days. How long can you survive without air? Well, bad news, you just have about 3 minutes. So it's really on the very bottom of our needs pyramid. If we look at the traditional pyramid of human needs, clean and breathable air is at the very bottom of what our bodies require to survive. The biggest problem in that is that air pollution exists, and it's a real threat. According to the World Health Organization, it's the greatest environmental health threat of our time. And there's not really any place on Earth where air pollution is more predominant than in our cities, where a lot of these sources of air pollution are, where a lot of people are living on small space together, and by that, where a lot of people are also affected by these immense levels of air pollution. If we look at where air pollution traditionally is coming from in our cities, we have traffic and mobility on one side, so the cars, the trains that you see in the streets. Even trains that run on electricity can cause air pollution. For instance, if you imagine a subway braking in a subway station, you have a lot of fine dust that comes from the brakes, from the tracks in that very moment that is also polluting the air. Then we have industry, electricity and heating in our cities. Often big power plants are close to the big cities because of the transmission distance. Here in Hamburg, where I'm sitting, we have a coal power plant that's probably just a couple of kilometers away from me. And we also have big factories close to the cities because there's the workforce simply there, and the logistics and supply chains are short. And around our cities, we have a lot of agriculture, both plant-based agriculture as well as also animals are also causing, for instance, by fertilization processes, different air pollutants. And this is a very big slide. I realized that you can download that picture from our website. This just should tell you air pollution is basically affecting every organ of your body, whether it's the brain, whether it's your stomach, whether it's your reproductive system. The different air pollutants that we're talking about here, like particulate matter, small dust that is in the air, like nitrogen dioxide. We talked a lot about that during the whole Dieselgate discussion, like ozone, like sulfur dioxide, like carbon monoxide, are all causing different processes of inflammation, disease, or long-term health risks, like an increased risk of cancer for your body. And we are breathing 15,000 liters of air every day. So there's really a lot of stuff that gets into our bodies. And sadly, they are acting a lot like filters. So things like particulate matter are being filtered out by your lungs. You're actually breathing out more cleaner air, but the problem is it stays in your body. And looking at the recent COVID pandemic, I mean, you already mentioned it. indeed, there's also some research papers that say that if you live in an area with high levels of air pollution and you contract the coronavirus, then the relative chance that you get severely ill or that you even die from the coronavirus is higher than if you live in an area with good air quality. So, taking all of that into consideration, why are we not doing enough against air pollution? That's the big question. And I mean, you can see it with photos like this, even in German cities, even in Berlin, even in Hamburg. Stuttgart is often in the news. We have these problems of air pollution. If we look at how we are traditionally monitoring and managing air quality, you cannot manage what you cannot monitor. Then we have basically three approaches. We have those big, bulky, traditional monitoring stations that are typically used by cities, and in Germany it's mostly the states who are running these, where you just have a bunch of them, if even so, sitting somewhere on the roadside and collecting some data. Then you have some crowd-based sensor networks like Luftdateninfo and similar other activities that are putting these sensors, small sensors, very affordable sensors that you can buy just for 10, 20 bucks online, putting these into the hands of people and just giving them away, and you can put them wherever you want and start collecting data. The problem with the traditional approach is that it's so hugely expensive and they take so much space. I always say it's the size of an SUV, which I think is an apt comparison if we're talking about the problem of air pollution. Then you can't really scale that monitoring network. So even in large cities like Berlin, like Hamburg, you only know in a couple of places how your air quality is actually developing over time and where you actually might have a problem with air pollution and where not. And the problem with the crowd-based sensor networks on the other side is the data is often not really reliable. Like these sensors are often detecting things like fog, as particulate matter, for instance, because it's not filtered out, the high humidity levels, or they also have other problems in regards to where they are placed. You can place them anywhere, which means you don't really have representative data that comes out of them. And this is why there's a new league, I would say, of startups, of technology companies that are building relatively low cost air quality sensors, but are using still the professional approaches of traditional air quality monitoring, like quality checks on the location of the monitoring, as well as also a real calibration of the sensors to provide more data, which is also what we are doing. So I brought you an example of Hamburg just because I'm living here. I mean, Hamburg is a city of 1.8 million people, second largest city in Germany, and we have 15 monitoring stations, right? And I think that's crazy. And it's no chance that there where you see the lot of small dots on the left in Altona, two of them are actually the two stations where we have the highest levels of air pollution that we know of in Hamburg, Stresemannstraße and Max-Brauer-Allee. And those two were also the streets where they closed, which they closed for diesel cars. So the places where they are monitoring, they're actually doing something. But for the rest of the city, if you have no data, you're not going to do anything about the air pollution. And here you actually see one of those monitoring stations in the streets. It's really incredible how big and large and costly they are. Also, they can cost hundreds of thousands, even millions of euros in their maximum configuration. We have developed very small sensors that you can deploy on street lights, on buildings, on similar other infrastructure, and that isn't the size of an SUV, and that doesn't cost that isn't hugely expensive, that doesn't cost hundreds of thousands of euros. And with that, for the very first time, we build dense sensor networks that we deploy in our cities, in our built environment, to learn more about what's actually happening in regards to air quality. And what happens there is that you're actually getting into a situation where you can use just a fraction of the budget that you have used in the past for air quality monitoring, and you can cover basically your whole city, and you have ubiquitous density of the data, ubiquitous amount of insights that you can generate. And with that data, you can do a lot of different things. And this basically follows this approach of measuring what is measurable and turning measurable what is not. So I don't think Galileo said it's internet myth, but definitely a paradigm that more and more, I would say, smart city approaches. I mean, every smart city startup nowadays is collecting some data. They're all following this approach. You either collect the data or you analyze it, or you're doing both together. And the great thing about this is if we imagine we have a whole city covered with ubiquitous and hyperlocal data about something that you want to analyze, like air quality, then you can actually start to identify trends. You can start to identify local influences on these factors, like air quality. I can see, okay, if I put a map of all the construction sites of Hamburg above that layer of air quality data, I can see that there's actually a correlation there. And in a lot of spaces where construction places are above a certain size, we have increased levels of particulate matter, for instance. And then I can start thinking about things like implementing tire washing systems for the construction vehicles and similar things to really put targeted action into place and spend the budget that I have available as a city as cost efficient as possible on actually improving the environment and thereby improving the lives and the well-being of the citizens. And because you have all this data available and you're going to implement changes and cleaner actions, and you see again in the data how that affects things, you can start building these what we call mutual causal interactions, so feedback loops, where you learn from these approaches and then use the data again in the future to be even more smarter about what to do and what not to do in regards to cleaner action. I want to tell you about a couple of projects that we did in the past, smaller ones as well as bigger ones. So I think one of the great examples is that because the sensors have gotten so low cost nowadays, we were actually able, together with a foundation, to equip a couple of schools with air quality sensors, just to put air quality data also in the hands of children, at the same time also investigate whether air pollution is too high at these schools or not, but at the same time also using this data as part of their science and sustainability lessons. If you have something tangible that comes from their schoolyard, it's much more interesting for children to engage on and actually learn about such a topic as air pollution, and then also build their own air quality monitoring devices from household materials, for instance, like we did in a workshop during the Hamburg Climate Week with a school class. On the other end of the spectrum, with the city of Neckarsulm, one of our long-term partners, we have started, I would say, 2.5 to 3 years ago to gather hyperlocal air quality, also share the data with the citizens and engage the citizens there. And we really learned, okay, the citizens are really interested in this topic. But at the same time, also, as I said, started to lay over other data sets and developing a cleaner action plan, which is now being implemented. So AI enabled, we're also using AI to figure out which cleaner actions would help best where. AI enabled cleaner actions which are as targeted as possible. And then again, monitoring the success of that. And even for a city, being very agile and being able to redevelop your cleaner action plan every couple of months to years to really drive targeted action in the built environment. And if you start to think about what else can you do with the data, you can do a lot of different other things, like, for instance, making it available to app developers. In one project we participated in, a Finnish startup called Proximia used data that we had from a project in Hamburg to build an app that routes you as a pedestrian from A to B while exposing yourself to as little pollution as possible. This app is now available in the App Store, by the way. You can use it already, I think, in Hamburg and in Helsinki. And this helps you particularly if you're an asthmatic person or if you have some other kind of chronic disease. These people are particularly susceptible to high levels of air pollution, but it also helps you, for instance, if you just want to protect your family, if you are, if you have young children, if you want to know which routes not to take, which routes to take to get to work in the morning with your bicycle, for instance. I think these are, and we're going to see much more of these approaches in the future, where many dimensions of smart city data are going to be used for things that we can't even imagine nowadays. On the other end of the spectrum, I also want to briefly talk about where we are usually spending most of our time, which is indoors. And the main problem there is that actually air pollution accumulates indoors. And we spend 90% of our time indoors, and air pollution indoors can be up to 10 times as high as outdoors. And that's also a real problem. And we also, at some of the air pollutants that we are looking at, for instance, CO2, it's not a real air pollutant because it occurs in the air naturally, but we as humans exhale carbon dioxide. And if a lot of people are in a room, or even if you spend a long time in a room, it accumulates there and the carbon dioxide concentration gets higher and higher. And you can use that basically as an indicator to recognize how much exhaled air is in the room, which in turn enables you to calculate some sort of COVID spread risk. The German Work Protection Agency actually put some regulation in place that is still valid until September at least, where they're saying, okay, you need to assess indoor air quality and CO2 levels to do COVID spread risk prevention in your workplace. And you asked, what have we done in the last year? We actually built a solution around this. So we already did indoor air quality in the past, but now we extended basically the solution to take into consideration real-time indoor air quality levels, real-time CO2 levels, and some others, and then alert users of indoor spaces if they need to ventilate the room because the concentration is too high. And you can put this on a screen, you can put this anywhere. For instance, the Digital Hub Logistics is using it. They don't have a lot of active ventilation. I think it's a very old building in the Speicherstadt here in Hamburg. And so they have it on a screen and everybody can use it. And then it starts flashing if people need to open the window. And I think it's a really smart solution, especially if you don't have a lot of smart building infrastructure. And all of that in the end follows this old approach of creating transparency about a topic, like air quality, then using this data to enable change, and then thereby also put momentum in field. Because if people can actually see what's happening, what they can do to change it, and then see their success, that builds a real momentum. And that is connected, to a lot of different sustainable development goals from the United Nations. I think first and foremost, the most important one is the Partnership for the Goals, because we can only solve issues like air pollution if we're actually all working together. If you want to learn more about air quality, we actually nowadays have an Academy section on our website. I put the link here, or just go to the website and click on Academy on the top. Every week, we share a new article on air quality, everything from how you calculate an air quality index to the COVID topic, to impact of fireworks on air quality, etc., for those of you that are interested. Thank you very much for your attention. If you are interested to do something on air quality, you can become a sensor host. We have a program where you can put a sensor on your balcony that we have certified as a good location for air quality monitoring, and then share that data with the public. If you're a startup that has a solution that can improve air quality, we can actually recommend you to our city and business customers, or if you want to work with our data, you can reach out to us. Thank you very much, and wishing you a nice rest of the evening, and looking forward to the panel discussion later on today.
Robert, that was super interesting. Thank you so much for taking us through the journey of air quality monitoring, the cool stuff you do with the schools as well, and also the story of how you're redeveloping now towards indoor air quality. So that was super interesting, and also a very, very fantastic case that really proves the fact that smart city and healthcare are now really accelerated towards one big urban innovation industry, an urban healthcare industry. So thank you for this case. Robert, anybody who wants to connect with Robert and his company, Breeze Technologies, we've put a comment in the comments, his contact details, his LinkedIn. Robert, thank you very much. Much appreciated.
Thank you for having me.
Ciao. Everybody, great. So we've had two wonderful impulses from a healthcare company and an urban innovation company. We now are fully primed on understanding what is the potential of the intersection of smart city and healthcare. And now we bring you the panel, Health in the City, the post-pandemic influence on those two industries. We have great people, Ulrike Bretter from Berlin Partner Cluster Healthcare, Professor Dr. Thomas Schildhauer from DUCA, Laura Wamprecht, Flying Health, Patrick Hennig von Luca App und Nexenio, und Dr. Jean-Robert Hoff from Ambus. I'll invite you all to the stage to join me now. All right. Nice to see you, everybody. How are you?
Good.
Yeah, good. Thank you for having us.
You have some energy in you left for a good conversation, yeah?
Yes.
Guys, let's do a very quick, 1 minute per person introduction round. Why don't you introduce yourself to our audience? Who are you? And of course, also, what are you working on right now? What's your thing? What do you have on your desk right now, except this panel, of course? So maybe I will tag Laura first, and when Laura is done, she can tag the next one to go. Laura, the stage is all yours. Welcome to the stage.
Yeah, thanks for having me. And I'm Laura. I'm a biochemist by training. I'm managing director at Flying Health. We are a company who is running an ecosystem for next generation healthcare. So what does it mean actually? So we serve about 20 organizations currently, from startups, SME companies, but also large corporations, who represent all different stakeholders from healthcare. So we are not just a consultancy for hospitals or for pharma companies, but what we want to build is a kind of mini healthcare system within Flying Health. So we can consult everyone of their own single strategic questions, so where we serve more as a sparings partner. But at the end, in healthcare, everything is really interconnected, so nobody can really be successful alone. And this is why we try to build a future business model already within our community. So when we develop an idea with one of the companies, then we always directly think about who can we talk to validate this idea. And this is basically why we think we are an ecosystem and representing the healthcare system and all. And currently, actually, topics are, it was really interesting to see the shift also from the pandemic, because for the last 5 years, I was praising digital health to everyone, tried to explain that it really makes sense. And now everybody got that point. And now we are coming to a phase of, okay, how do we do it? And so we are going more into concrete projects and working on individual cases. So I hope that gives you an idea what we are currently working with. I need to have someone. Yes.
Yes.
Let's see. Ulrike.
Well, hi. I'm Ulrike Breiter. I'm working at Berlin Partner in the cluster Health Capital Berlin-Brandenburg. As Berlin Partner, we are the business development organization of Berlin, doing what you might expect a business development organization does. So we support companies in their investment, expansion, and innovation projects, especially in finding the right location in Berlin, finding finance programs and support programs, and in finding the right personnel. I myself work in the field of innovation as I said, within the cluster of healthcare Berlin-Brandenburg. This means together with the Business Development Agency of Brandenburg, we do the cluster management in this sector. And what is our aim? We want to connect people from the industry, from startups, from sciences, and from the healthcare sector, meaning hospitals, care communities, and so on, in order to develop new innovation projects and help them also to find financing for it and to make them come true. So this is actually the goal we have. Well, and I have also to tag somebody, so I would tag Professor Thomas Schildhauer.
Yeah, thank you. Good evening to all of you. Thank you for having me. And I'm a computer scientist as main profession and founder and director of the Humboldt Institute for Internet Society. And I'm a researcher with passion for open innovation, user-centered innovation, and internet-enabled business models. And my role today is I'm also the initiator of the Digital Urban Center for Aging and Health, the DUCA. And DUCA is a human-centered research center and a place of learning in the health sector, in urban districts, in nursing districts, and most important, on site. So we are going out of our research offices, going into the field and talk to the people where they live and work. And our innovation partners in that DUCA initiative are stakeholders from several groups. So, for example, from the caregiving, we have the Diakonie, Stephanus, EJF from Berlin Hospitals, DRK, Vivantes, Charité, financial institutes and social banks, so the Evangelische Bank, Bank für Sozialwirtschaft, and medical doctors, city and building developers, as you mentioned before. The GEWOBAG is one of our stakeholders. We have IT developers and research institutes like Honda Research, Conda Telecom, digital health startups we have with us. Medondo is a dental startup. We can talk about that later. And all the research institutes, for example, in Berlin and all over Germany. So the ECDF and the German Internet Institute. So, and I will take as next I have to open the window. Patrick.
Yeah, thanks for inviting me. I'm Patrick, and we build, develop, and operate the Luca app. Maybe first of all, let me tell you that I've never thought that an application like Luca can raise so many discussions during the pandemic. But yeah, there are good points in it, also in all of those discussions. What Luca basically is, it's part of the infection tracing of health departments in Germany, as in most of the federal states, it's required to fill in your names. I think all of us, we know this and we have experienced quite often. And with Luca, we built an application that is directly connected to most of the health departments with a cryptographic scheme that the contact details that every one of us gives in, or if we put it into the application, is secured until a health department really wants to trace an infection chain, and then I get also informed in case a health department gets access to my data. And yeah, this is actually the whole story for bars, for restaurants, hotels, to make their life easier when they have to do the requirements to register their guests. And yeah, this is Luca, and as I said, I'm happy also to give you some insights on all the discussions we had in the last year. And as I said, I've never thought that we have so many discussions, and if you ask what is lying on my table, a lot of those discussions, and I'm happy to share the details with you.
Great. Thanks, Patrick.
Yeah, so I
Sean.
think we have to hand over to the last one, Robert, right?
Yep, exactly. Yes, I'm the last one. Thank you for having me. Good evening, everyone. My name is Sean, and I'm a physician from the United States. Since I graduated from medical school, I've been working in health tech for about 4 years now, primarily in medical education. I work at Amboss now, which is a startup located in Berlin, and we offer basically two main products. One of them is English-speaking platform. The other one's a German-speaking platform. There's a good deal of overlap there between the content of those two platforms, but there are also some differences based on how healthcare is practiced, how healthcare is taught in those two main regions. Something I'm working on now is ultimately trying to help students prepare for their exams, their medical licensing exams, as best as possible. And one of the things that I'm focused on, or a feature that I'm focused on right now, is basically giving the user customized or tailored content through their dashboard. So when they come into the Amboss platform to either answer a clinical question that they have or to study for an exam, there's content that's relevant to them, or there's content that's relevant to their performance or their use case and their behavior within the platform before. So ultimately providing a more customized experience that meets the needs of the students and trainees each moment is something that I'm working on these days. Thank you.
Great, Sean. Much appreciated. Thanks everybody for introducing yourself and telling us what you're working on. We can sense already quite a lot of action and movement and momentum. So it's really exciting just to be part of this. You wouldn't expect that from the healthcare industry. And now all of a sudden it is the most moving and shaking part of our society, or one of the most moving and shaking parts. Can you guys make me understand, like, what exactly is different? Like, for example, Laura, you mentioned now everybody wants to talk about healthcare. Like, what does it mean? Like, how do I envision this? What's happening right now beyond like the very, very prominent example case from Patrick, for example, from Luca?
Yeah, so we work with a lot of hospital companies, for example. So we have 3 major hospital groups in our network. And within the last couple of years, so before COVID, it was really tough to convince one single physician using a telehealth tool. Then it was really hard to define with the data security officer, with the IT guys, of course, to select one of the tools, then find a use case. Then we had a small population of patients, which we all considered carefully if they can manage to do telehealth visit. And within COVID, then from one day of the other, the healthcare system told the people not to visit the physician anymore. And then it was suddenly so easy to switch onto telemedicine platforms because people had to do this. And now they made the experience that it's still fine. So nobody died. So I never heard a case that someone died due to a video consultation. And I think this kind of experience now is bringing us to a better baseline. So like we are doing now this online conference, a lot of the people also had their video experiences in the private life. So also, even though older people, they just adopted to FaceTime, Skype or whatever, because they wanted to stay in touch with their families and loved ones. And this is what we now recognize, that all the concerns from before COVID, they are not really the problem anymore. So now it's more about how we do the rollout, how can we implement it really sustainably in our everyday routines, and how can we optimize our clinical workflows, and what are add-on tools, because video consultation is just one thing, but how can we integrate, for example, wearable data? How can we integrate maybe algorithms to analyze our voice or anything like that? So we definitely jumped on a higher level, at least regarding telemedicine. And on the other hand, also the politicians have raised some market entry models. So like the DTX, for example, so digital therapeutics, they now have a clear way to market access, which is very new. And this is where we are learning currently about.
So this new speed that you're in, this new momentum, do you think this is sustainable, or will there be a rollback to the old ways of doing things?
Partly, I guess, yes. So when I want to be realistic, of course, we won't stay at this level where we are currently, but we will land on a higher level. I think Shari already mentioned that there was a cap also for GPs, for example, that they were, before COVID, they were allowed only to serve 20% of the time in virtual care. Now we are at 30. So already we have a higher percentage, which is fine. So I think we can use this momentum, but it won't scale like this. So I think we are going also into the chances of startups and investors, etc. later on. But I think it's still a tough market when you want to be successful on the long run.
Is it the same experience in the care industry, Thomas? Has there been movement? Has there been any changes?
Yeah, so what we learned is that especially established companies are more willing to collaborate in an open innovation environment with startup teams. Of course, they help them to be faster and getting digital solutions very at hand. But we have to check how does that help the elderly people, as Laura said. So, for example, we have a solution at hand where we're doing research on. It's a kind, you have to imagine it's kind of a lamp, and it's with a handle. You can carry it around, and instead of lampshades, you have video screens, and only one button. And elderly people can push that button and are easily connected with their relatives. And so they carry it around the kitchen, in the living room. And these solutions help, as Laura said, to give people who are in social distance during that COVID time to be more connected with their relatives, with their friends, and with the social community.
What does it take to scale a solution like this? Who do we have to talk to about this? How do we make this a solution a scaled success? Thomas.
Yeah, so one main and important point from our point of view and experience is that we have to have very short loops for the user experience. So we have to find out, is that useful? Are there older people can have an easy access? Does that help? And if not, what should we develop instead, or where should be in the best way as a lean startup approach be the next incremental phase? And so that could be the best way to have a kind of a learning lab. This is our approach to go into the areas where the people live in their flats or in their caring districts, and just ask them, bring solutions with us and show them how it works and get feedback.
Patrick, what was your experience? Can you relate to what Thomas and Laura just said? Or would you say the Lucas story was different?
Well,
I'm assuming the latter.
I think a very important part is a very important factor is speed, that everything we do here, and also when for all of us, it was the first pandemic experience, right? And also when we built Luca, we started last August with the first health department, and we tried to get different people, different stakeholders on board. And if you look in software, and if you look what we have done before, we have done a lot of security together with the Federal Mint here in Germany, the Bundesdruckerei. And there's, for example, another project where we have done software certifications. It took us 4 years. But during the pandemic, you don't have 4 years to build an IT project and to plan everything. So you just have to start. And I think this is something we have done. And I would say also in terms of scalability of such a project, we have rolled it out to 320 health departments in 6 or 7 weeks. And this is not something that just at the end is based on technology, but you have to involve all the different people in the health departments. You have to install certificates, things like the people haven't used before in any case, right? And I think this is also something where I have to say from the experience that we had a quite good experience at most of those health departments. It's not like they are sitting there without any computer and without any experience. So there are well-trained people as well, and they have found a way to come through all of those issues and all of those tasks they have to do because they were quite new. And I think this is something that you have to take into account, that you have to talk and take all of those different stakeholders with scaling such a solution, saying health departments, bars, restaurants. And sure, if you look at at a bar around the corner, they haven't dealt with private keys before, and I think for good reason they haven't dealt with those technologies. But you have to find a way to bring these technologies also to them and to transfer this knowledge. And on the other hand, you have a user, as we all know how IT and apps work in our daily life. But also this is something that you have to take into account. And I think you were just mentioning, Thomas, it's the same for us. We have an app on the smartphone. But when I remember, I think it was November when we first were in a social institution, a care home in I think around Magdeburg and around the area of Magdeburg. And there we recognized 50% of the people didn't have a smartphone. And we figured out those key tags, and we got a lot of issues with the key tags later on. But I would never say it was a wrong decision, because we were able to save 7-8 minutes and every when people were visiting their relatives in their care home. So I think there are different parts where you have to really take and look into the details, how processes worked before, and how you have to build a solution like this to really scale it, because actually you always fight against the time, right? And speed is the most important part here. And on the other hand, you have the whole security area. And let's tell you one thing: in Germany, we have 16 federal states, so we have 16 different data privacy opinions. And not only 16, we have 300. So we are dealing with 320 cities and counties here in Germany. They have their own data privacy guys. So we have 400 pages of data privacy documents, IT security concepts, and all of those stuff. And you have to discuss this with each and every single one of them. And just imagine discussing 400 pages with 400 people is actually a task you cannot achieve this. And
do you have more lawyers than engineers?
Not more, but we have a lot of them right now, because this is also an issue, right? You have QR codes and everyone can. So we had one case, for example, someone said, I have a patent on a traditional QR code. You have to follow up on this, because he sent out emails to 300 different counties saying, oh, Luca is actually, you're not allowed to use it because I have a patent on a QR code, even though he got a negative report from the European Patent in department. So it's very tough, because you have to deal with all of those different interests and stakeholders. And this is something I never thought it might be so complex.
So the complexity is one thing, of course, as well, I understand, but also the level of trust. In your case, you've been given a lot of trust from, I think, both consumers and the healthcare sector. What was the magic behind that? How do you gain the credibility and trust? Was it coincidental? Was it the technology? Or was it the right time at the right place?
I think it were different ones. Yeah, the right time and the right place is always a good basis, right? But I think that's alone is not the part how it worked at the end. It's also you have to be lucky enough, right, at a certain point in time. But I think there is one thing we have done in a different way than other applications that were dealing with contact data and registration in bars. We have always started contacting health departments, and we worked together with the first health department out of the city of Jena. And we listened to them and looked into the people, how they work. And it was a time when they were searching in the newspaper for contact persons for, I think, two parts. It was a wedding, and the other part were also relatives in a care home. And there we figured out, okay, it's not just about registering and getting data, it's also about how they can be processed. And if you look at 320 health departments here, we learn from a lot of experienced people, but you can imagine they completely work in a different way. And this is something that is really tough to handle. And I would say, yes, it was all of those different things that had to come together. And then but I think this is the part that we have done differently. We always concentrated about the area of health departments. We then started with Sylt, another health departments. We had 3. We talked then to another 150. And after the 150 health departments, actually that was a time when no one was taking care about us, not about me, not about Smoother, not about everything. It was just before we had hundreds and hundreds of calls and discussions with radiologists and about what can such a technology do, because it's just a technology. It's not a complete game changer and a solution for everything. And this is something where also expectation management is something a tough part and something that can get you in a wrong situation. And I think these are the things you have to take into account. And sure. And the user is another important part. Now we have almost 30 million downloads in Germany. And yeah, you have every different kind of a user out there. And if I look into the emails that we get each and every day, and there are really hundreds of them, there are really funny stories in it, but there are really important stories in it. And I would like to have much more time to focus on feedback. For example, if someone in the age of 85 is telling us that the button for checkout is very unintuitive. And these are the things you actually have to take into account. But the sad story is you don't have enough time to focus on these important parts.
Well, in your case, of course, the market is huge. Your user group is very diverse. I'm quite interested in if there is a generational divide between user adoption for healthcare solutions. Jean, I'm quite interested. You're working for one of the winning companies in healthcare. Healthcare industry is traditionally, of course, non-digital, right? So, but you guys have made it stick with your user group. How is that? How did you do that? Is your different to Patrick's user group? Is it just millennials who are by nature digital natives, or how did you guys make it stick for students and or healthcare professionals?
I think there were a few factors. Number one would be a generational impact from millennials and Gen Z folks being very comfortable using software to address any of their concerns, whether that be educational or in their private life. The second thing, I think there was kind of a lucky market effect in the sense that there were a lot of unmet needs provided by the traditional basically resources. For example, we have a textbook that is printed maybe once every 5 years, updated once every 5 years. Now, with the new technologies that we're using to establish information, new scientific discoveries, the pace of those changes, the pace of those discoveries has really accelerated, such that a book which is published every 5 years is not quite going to cut it. As a result of that, a digital solution or a digital platform which can educate care providers and sometimes even patients is something that is much more updatable. It's something which allows for much more collaboration between healthcare providers and ultimately can meet the needs of those users a little bit better. The major problem that I think we encountered was just the issue that I think a lot of people in this healthcare tech space encounter, and that is an app is an app is an app. And if I download something to help me with my dating profile or something with my gardening, how do I know if that is more or less trustworthy than another app or a healthcare app? And medicine and healthcare are really full of those symbols of trust For example, the doctor wearing the white coat, etc. As soon as you see a doctor walk in the room, there's a degree of professionalism, a degree of approved by a bureau, approved by a regulating committee, whatever, and that gives a degree of trust. And the thing that we did to establish that trust or take advantage of some of those symbols were to put healthcare providers out there and make sure that people knew that it wasn't just tech guys sitting behind a computer and programming or pulling from Wikipedia and writing articles, but actually doctors writing content and producing a product that was fit for doctors and designed with their needs in mind. And that involves a good deal of thought leadership, a good deal of education, a good deal of outreach carried out by the doctors themselves.
What do you think is a bigger burden or something that slows down the process? The lack of digitalization in the healthcare ecosystem, or rather the adoption rates from the physicians, for example? People argue that there's no point for the healthcare sector, even the government, to be faster because the physicians don't want to, right? They don't want to digitalize. Yeah. I assume that the ones who are on your platform are not those types.
I think that's correct. Yeah, I can say that there is a underlying theme to the Amboss product and other competitor products as well, which are the degree to which time is saved by using the Amboss library or saved by using Amboss as a clinical consult. If a physician, for example, were to have a clinical question that they could search for, maybe they'd have to go through a bunch of articles on Google, or they might need to look at a scientific database and read through 4 or 5 scientific articles, trying to find that one piece of information. Amboss and other services out there are designed with trying to condense the information, trying to make it accessible and digestible. And that's something that really, if you look at medical records, digital medical records, and health information databases like that, the time saving isn't quite there. In some ways, you spend more time clicking boxes or searching for things than you would if you just took a note. Obviously, notes have downsides of being physical object that you have to store. The handwriting of doctors is known to be very bad, myself included, and that involves a lot of mistakes. There also isn't the ability to collaborate between healthcare systems or care providers, which is our major downsides. But in some ways, with complexity of healthcare, time saving and ultimately the burdens of doctors has sometimes been forgotten, and that might, in my mind, lead to reduced adoption rates, especially given how much the healthcare system is stressed with some of the things that other speakers have mentioned, including aging population, increasing burden of chronic disease, and the relative population of people versus the population of doctors, that being so out of whack these days, it makes it very difficult for new technologies to be adopted and put into use.
Great. So thanks for explaining about user adoption, Sean. That was very, very insightful. Ulrike, I think you're probably one of the most networked people in the Gesundheitswirtschaft locally. So can you tell us a little bit what has changed from your perspective? So of course we've heard now from multiple of our colleagues and peers here now that there is movement and momentum. But what I'd like to know is what are the dynamics? What is the vibe of the atmosphere? What is the atmosphere? What is the shift in the power dynamics? Maybe what are the startups doing? What are the corporates doing? Who's at the table?
Well, it's a big question, to be honest, and I would first focus on 2 different points. And on one thing is that what have you learned within the pandemic? That if we want and if we need it, we are able to responsibly speed up regulation, right? We have seen how quickly the vaccines have been developed, and we have seen how quickly they have, with this rolling evaluation, been how quickly the admission process has been. We have seen it with the video consultations, which we have heard. So I think there is a spirit of things are possible. And some things are possible that we might have not deemed possible in that speed before. This is one thing. Then I think we have more, or well, our whole system is built on we cure people, and what the pandemic brought more into our minds is that we have to take care also about prevention, and that we have to look at public health. So it's not a new idea to say, well, we have to make health in all policies. This is an old, for people working in the field of prevention, it's an old slogan, so to speak. But now with the pandemic, it got into people's head, and this all things what you talked about in the beginning, smart city and healthcare and the connection with regard to health and all policies, that makes much sense. So and I think people realize this more and more. And what we also see, I wouldn't say it's only a thing of a result of the pandemic, but we see it right now also with respect to the pandemic, that this kind of social entrepreneurship is developing more and more. And we have also many startups in this field that have for themselves, they don't only look at the market, of course they look at the market also, but they also look at their social responsibility. And I have one example. We have a startup called Crisis Chat. They developed a chat tool for young people in crisis who have problems. So they have a network of psychologists working on a honorary basis and chatting with those young people in need 24 hours per day. So of course not everybody 24 hours, but so they are available 24 hours a day for those young people. And I think these are really great developments. And again, if you look at this one company, they use WhatsApp. Who would have dared to say you can use WhatsApp for such a service? But they use it because this is the medium young people use. And if they want to reach young people in need and in crisis, you have to use this medium, and they do it. So I think many things have become possible now, and this is maybe one of the most one of the biggest impacts you see.
It's good that you mentioned this, because actually quite interestingly, I'd like to know, is it really startups who have the potential to make a dent in the healthcare industry? Because, let's just compare it to, for example, another highly regulated industry, fintech, where VC is being thrown at startups. And the VC game is really driving disruption in the fintech environment, whereas in healthcare, that may not be the case. So will the startup industry, will the tech industry, will the venture capital-driven ecosystem have a new momentum?
You mean for healthcare, or will there be a new momentum for the industry?
For the healthcare industry, yes. Who will be the driving change makers in the next 2 years?
Who will be the driving change makers? Well, of course, the possibilities of digitalization have huge perspectives for the healthcare industry and for the healthcare system. And I think one thing we see in the German healthcare system, it is still very fragmented. And one thing we need, if you look at a patient, if you look at people, is the collaboration. We need collaboration between the sectors. We need collaboration between, the care sector and the acute sector, between the outpatient, inpatient sectors, and so on and so on. And digitalization and the tech industry makes a lot of this collaboration possible. So of course, it has a huge impact on the healthcare and the healthcare system as we make it, or as we know it. I spoke about prevention. So due to big data, due to wearables, due to the platform technologies, there will be possibilities of prevention, of monitoring the health of people we didn't know before. So of course there will be a huge impact by the tech industry.
Maybe, Darius, I would like to add something about that. Who is the driver? I think for me it's definitely the regulator. first, because the regulator is creating a budget for digital health, because this was something which was not there before COVID. And on both sides, first on the investment side, so we need digital infrastructure, what we see now, which is very nicely up supported in the Hospital Future Act. So it's a large governmental funding program to boost what we have missed in the last maybe 10 years in hospitals. So just ramping up infrastructure. So I think this is also for Amboss really important, that we now have some movements in the IT department, and not only regarding the investment side, but also when it comes to reimbursement. Now we are seeing that there are budgets now. So digital health has now a value. And this is actually the basis when you want to build a sustainable business. You have to have the perspective of how can I earn money with this product or with the service. And this is now where coming to a point, for example, the digital therapeutics now have a clear pathway how to make money in the business. Also regarding telemedicine, we get more and more codes for reimbursement. So now we are coming to the creation of a real market. And then also VC funding maybe can make sense. But it doesn't make sense in the market to just pump money into a startup when there is no perspective for a sustainable business model. So I think the goalkeeper still is the regulator. And I think there's still more room for improvement.
I understand. Great. Thanks, Laura. Thomas, go ahead.
Yeah, I just wanted to add that one driver could be, and I learned this during the last month, maybe that we work together on new public-private partnership models, even integrating the regulators, as Laura said. And we see companies, of course, it doesn't help to have a smart business solution when there are boundaries where it can't be coming into the market successfully. So if we are able to build up new public-private partnerships, that would be maybe a very good driver to faster and more successful solutions.
Great. Public-private partnerships, a very interesting approach, of course, that could be a driver, of course, for more action and more realistic action in the healthcare ecosystem. I have a final question for everybody before we let the crowd go into the Zoom networking. So, considering the learnings that we've had now and the discussions that we've had now, what are the one or two trends that you would put all of your money on in the next 2 or 3 years, the intersection between urban innovation and healthcare, or just healthcare? Like, what do you think will majorly scale in the next 2 or 3 years? What's your bet? Who wants to go first? Where do you put all your money?
I can go first.
Go ahead, Sean.
If I think about the paradigm between Western medicine and Eastern medicine, so like traditional Chinese medicine, in old China, you would pay the doctor on a regular basis to keep you healthy. Whereas in kind of Western medicine, we go to the doctor when we have a problem and we pay them or compensate them some way for getting us feeling better again. And I ultimately see the overburdening of the healthcare system as preventing most patients from seeing their doctor enough or interacting with their doctor enough and getting enough value out of those interactions such that they can maintain their health over a long period of time. And ultimately, I think a subscription-based model for several apps which basically allow users to live a more fulfilling life, either within the confines of their home, doing the right exercise, the right mental health activities, etc., while in pandemic, while in lockdown, or even as they're moving through the city and living their life and trying to avoid pollution, etc. I think the right amount of fees and the right amount of subscription model could be quite popular in trying to fill in the gaps that patients feel are not addressed by the infrequent and sometimes unfulfilling interactions they have with their physician.
Great. So we know where your money is going, Sean. Thank you very much. Who goes next?
Okay, I go next. I would bet all my money on smart solutions to empower the people to live healthier and combine it with a long-term learning lab approach on site, as I mentioned. Of course, I'm pretty sure that if we are able to build up centers where this iteration is better and faster, and we involve especially the elder people earlier, then it would come out for solutions with a really helpful, and helpful not only for the person who's using it, it would be helpful for the relatives, it would be helpful for the caregivers, and at least, for example, for insurance companies, of course, prevention algorithms could help to install solutions which prevent, for example, fall situations, and that helps the people to stay longer healthy, and gives support and positive business model approach to established companies.
Great. I'm excited to see how Duca will have an impact on exactly that. Very, very good.
And why in 2 years?
Where does your money go, Patrick?
Well, I would say it's. I wouldn't maybe particularly talk about medicine in detail, but I definitely would agree on what the others said, that it's all about the interaction between me as an individual and services like medicine, services like also it could be health departments, but it could be also the public service and all of the services I consume. And I think if we can save time for each and every individual and get more out of it, and it can be in economic and also in the air pollution, whatever areas where we can all use our connected world and save time for all of us and make life easier. Not only what we learned in the pandemic, we learned that technology can solve one part, but it's not all about only technology. The humans are at least as important as technology. And I think everywhere where we have exactly this interaction between humans, technology, and institutions, this is definitely the way I would go for. Individual applications on my smartphone and interaction with all the services we consume each and every day, but in the future in a much faster speed than ever before.
You've proven that it works. So there is hope for that as well. Thanks very much, Patrick. Ulrike, where is your money?
Well, I think I would put it into a platform or an ecosystem which enables good cooperation and data exchange between all kinds of health workers, from the doctors via the care workers to informal care and community services, so that this data transfer and the collaboration will be possible and easy, much more easy than today.
Great. You may find some co-investors here in this group. Laura.
Yeah, so I would invest in the intersection of life science and digital technology. So mainly I think about digital biomarkers and digital diagnostics. Because I think this is where we just touched very few points. So that we can have early detection of, for example, Parkinson, dementia, etc. So many diseases I think can be detected much earlier, and then also people can receive better treatment. And I think there is still a great potential.
All right, everybody, we've got a lot of good hints where to look at, where to spend our Taschengeld into the healthcare sector. So, guys, thank you very much. It was great to speak to you. We have a very diverse panel here, so we were able to go into a few different directions. I appreciate that. I'm sure the audience as well. Thank you very much, Laura from Flying Health, Thomas Schilthauer from Duca, Jean-Robert Hoff from Amboss, Ulrike Bretter from Berlin Partner, and Patrick Henning from Nexenio. You've been great. I appreciate it a lot. Maybe you will come and join the networking to the crowd. Oh, by the way, also thank you to our two previous speakers, Shari Langemak and Robert Heinecke from Breeze, and Shari from Relearnlabs, who also seem to give a couple of good impulses that fed into this panel. We've shared LinkedIn profiles of all of the speakers in the comments. I'm sure we will have some connections now made on Zoom. The team is sharing the Zoom link now in the chat. So anybody who wants to join us in the networking can do it now. Let me see if the link has been posted. Has it been? Yeah, link has been posted. And again, so anybody who wants to engage with us, BIA, in our digital health hub or in our smart city hub, you have the links, or just reach out to me, Darius at bia.team, and find out what our next activities are. I thank you all again. Have fun in the Zoom networking. I really suggest you try it out. It's actually quite fun. And I see you guys in the next events around healthcare and urban innovation. Thank you very much, and enjoy the rest of the activities. Thank you.
Thank you.
Thank you, Darius. Thank you for having us.
Thanks for coming.